I'm Dr. Jennifer Hensley, primary care pediatric nurse practitioner with Amazing Kids Autism. And with me, I have Simone Olson, my co-founder and best friend, and we would like to welcome you to Amazing Kids Autism.
Hi, I'm Simone Olson. I am so happy to be here working in Amazing Kids with Jen. I recently left the U.S. Department of Education after a 30-year career working with kids and running a national program, and so I'm really excited to still be focusing on children and helping families.
So we are a primary care clinic, and I'm a pediatric nurse practitioner. I've dedicated my career to working with children with autism. And we are different because we're going to go from a 2-year wait list down to a 72-hour. We have availability for comprehensive medical evaluations for children with autism within 72 hours. There's a little bit of work on the parents' part that needs to be done, completing testing and paperwork, but our mission is again to decrease that wait time from 2 years down to 72 hours to get your kids evaluated and develop a treatment plan as soon as we can to get them set up for success.
Very often when people hear the word autism, they just become afraid and think that it is almost a death sentence. And Dr. Hensley absolutely does not feel that way. She feels that all kids have potential and that her goal is to help all of these children reach their potential and to not be afraid and to be able to go out in the world and be independent.
And parents, I hear you. I see you. I know you're scared and I know you feel overwhelmed. And I'm going to tell you, your kids are going to be okay. Whether they have autism or they have something else or they don't have anything at all, like we are going to build a team together. We're going to get your child set up for success. So I think that's another difference with Amazing Kids. If I rule out autism, I'm going to give you clear direction as to what needs to happen next for you to help your child get set up for success. So we are focusing on autism diagnostics, but we're not limited by that. And so if your child has autism, we're going to build an amazing team. And if your child doesn't have autism, we're going to figure out what your child needs to get your child set up to function at the top of his or her ability. So you are not alone. We are here, and it's all about teamwork.
Jen, before we get into the clinical side of things, I'd love for you to share what pulled you toward autism. I've heard you say you've never met anyone else with quite this level of enthusiasm for these kids. After more than 2 decades in pediatrics, what made you say, this is the work I want to focus on now?
Simone, that's a great question. So my career path has been truly directed by my faith. I started working with children with autism in college as I was in nursing school. And I was just amazed by their abilities. I had 2 little boys that I worked with that are still near and dear to my heart. As I was in nursing school, I had a side job. And I was doing actually the low-VOS behavioral method back then, which is an archaic method of what we now call ABA therapy. And I worked very closely with these kids, and I was just absolutely amazed with their gifts and their talents. And so as my nursing career progressed, and I eventually went to school to get my pediatric nurse practitioner and work in primary care, my path has continued to direct me back to children with autism. I've taken care of thousands of kids with autism, and I am amazed every time I have a new patient of the capability of their brains. And so my mission is to empower parents with teamwork and give the parents the tools so that they can get their kids to function at the top of their ability.
Speaking of parents, when they first hear the word autism, there's often fear. What do you see families struggling with most in the early moments?
Oh, that's another great question, Simone. And so early on, parents always know that something is not right. So parent intuition is the key, which is why, again, empowering parents with teamwork is our mission. Parents always know that something's not quite right, and they might seek advice from their dear loved ones, their family, their friends, their primary care provider, neighbor down the street. They know that something is just not right, and so they fight and fight to prove to the world that something's not right with their child. And then eventually someone will start listening as the child maybe gets into school or daycare, or someone has experience with autism and says to the parents like, hey, have you considered an autism evaluation? So then that starts to solidify to the parent, wow, I thought something was wrong with my child, and now somebody else is acknowledging that something is wrong with my child. And there's just a lot of fear and unknown throughout this whole process. And so parents finally get to the point where they get a full evaluation for their child. And oftentimes it can take anywhere from 1 to 2 years to get this evaluation. And once they get the evaluation and they find out their child does have autism, parents really have to go through a grieving process. But it's important to recognize that they have to go through this grieving process because we need those parents to get to acceptance so they can empower their child's team and build the best team that they can for their child.
It's just such a great and novel thing to hear that autism just isn't something to be afraid of. It's just a different way of thinking. And it just must be an amazing feeling to see when you see parents' shoulders drop when they finally hear that it's nothing to be afraid of and that you can learn to move forward. One question I hear over and over is, who do we trust to diagnose our child? From your perspective as a medical provider, what should families be listening for when they are talking to someone about an evaluation?
And I think this can be a very confusing question for a lot of families because there's not a clear path for diagnosis. Every clinician is very different. Not every specialty has the skill set to diagnose and offer a treatment plan. And so it's important for parents to find somebody who has the experience. And so primary care definitely has the experience and the education level to do these formal autism diagnosis. Sometimes they don't necessarily have the time and the staff to support doing all of the developmental testing as well. Developmental pediatrics, it's always in their toolbox, but someone who's doing developmental pediatrics is also treating children with a variety of other developmental disabilities. So autism isn't the only patient that they're caring for. And then we have our psychology colleagues who do all the developmental testing and psychological evaluations. And not every psychologist is trained to do autism evaluations. And then we jump to psychiatrists and neurologists, which again, sometimes it's in their wheelhouse and sometimes it's not. And then we have our therapy colleagues. So you have your speech therapist, your occupational therapist, your ABA therapist, your physical therapist. And none of the therapists can actually formally diagnose autism, but they have a lot of experience working with kids with autism. So sometimes parents will get a single provider to do these evaluations, and sometimes there'll be a multidisciplinary team that might consist of multiple of these experts to help do the evaluation. But there's not one direct path, but it's really important to find a clinician that has the clinical expertise because autism really is a clinical diagnosis. We do have developmental testing and tools that we utilize to give us additional information. And here at Amazing Kids, we do a comprehensive autism evaluation, starting with a full developmental history. We take multiple of standardized testing tools, which allows us parental input. And then we do spend a good 90 to 120 minutes with each patient observing, listening, interacting. And with that whole picture, that's where we come together and discern if the child does or does not meet that criteria. So finding an expert that has the skill set is going to be very important because this is a lifelong diagnosis. It's not something to take lightly, and it's not something that we should skip any of that process, is what I believe. And so again, we provide comprehensive autism evaluations here at Amazing Kids. In addition to that, we're also going to do a medical evaluation. Some kids may not have autism and they may have another genetic disorder that we can identify, or maybe there's a hearing impairment and it might look like autism. So at Amazing Kids, they're going to get a full evaluation, which would include, again, each step of that process. In addition to that, they're going to get a comprehensive treatment plan and a path moving forward. Again, our mission is to empower parents with teamwork. So if we can get these kids properly diagnosed, we can develop a team and a plan to give to the parent so that they can put that coach's hat on and build the best team that they can for their child.
And I think it's to circle back to something you said earlier, if something doesn't feel right, it probably isn't. I think it's really important to say out loud that families are allowed to ask questions and they should ask as many questions as they feel they need. Can you help families understand something that's really confusing, the difference between a school-based evaluation and a medical autism diagnosis? You briefly touched on that earlier, but could you expound on that?
Absolutely. So a school-based evaluation and a medical evaluation are completely different evaluations, and they are non-conclusive for one another. So it's important to get both a school evaluation and a medical evaluation. And without a medical evaluation, it's not going to limit a child if they haven't had one to get the school-based services and vice versa. So a school-based evaluation is going to focus on educational needs. That's the whole focus. So if the child is thriving in the educational environment and they don't need any support, there's really no need to do an educational evaluation. If the child is struggling in their academic world, then that's where the school-based evaluation would come in. And most academic school systems are going to have a school psychologist that would do a comprehensive in-school evaluation to determine if the child has any learning disabilities, cognitive impairments, or anything that would be impacting the child's day. And it might be something even, having a lot of challenges with the fire alarm. And when we do our fire drills at school, if the child is having a meltdown, a lot of behavior challenges during that time because that sensory is too overwhelming for them, then the school occupational therapist can work with the child so the child can participate in the fire drills and knows what to do if there's a true emergency at school. A medical evaluation is very separate. Again, could be done by a psychologist, but not a school psychologist. And a lot of the testing may be very similar, but the medical evaluation is typically where the path that a parent would go to get medical needs for their child met through their healthcare benefit outside of the school system. So a child may qualify for speech therapy in school, but we also need to have a medical evaluation outside of school so that we can order the speech therapy to get that intervention outside of school. So again, two very different processes and both are very necessary. One thing to just add as far as the academic evaluation, if you're homeschooling your child or if your child is in private school, the private schools don't all have all the resources the public schools do. And so go through the public school and have your child have a formal educational evaluation. Doesn't necessarily mean your child needs to go to that public school, but your tax funding, your tax dollars pay for that service. And so it's important to have that evaluation. Then you can take that evaluation and apply it to either the homeschool environment or the private school. But again, two very separate entities and both are very necessary. We got to give you the tools, but your kids are amazing, but you still have to kind of mourn this because your child is now getting that formal diagnosis and it can feel very, very overwhelming. The Autism Playbook is the book to say, hey, going to be the coach of the most amazing team in the whole world. And my child needs me to do that. So I got to get through this grieving process. And we actually even reference the grieving process in the playbook. But every child with autism is very different, just like every child is very different. Every person is different. And so you have to build that team for your child. And that's really what the playbook is about. Who goes on first base? Who's on the catcher? The catcher sees the whole field at all times. That's a very important position. Who's pitcher? Who's in the outfield? And we might find that the speech pathologist is on first base right now and they're going to be involved in every play. But once your child's language starts to develop, maybe the speech pathologist goes on the bench for a while. And then we become a teenager and realize, oh, there's some kind of monotone speaking and the child's prosody of speech is not where it should be. So maybe we'll bring him back out, but we're probably not going to put him at first base. We'll probably put him out in maybe center field, ready for action at all times, but not necessarily in every single play. And so that's what the Autism Playbook is about. It's really teaching parents how to build the team for their child. And it's a complicated team and it's going to change. And some players are going to be worthy to be on the field. And if they're not doing their job, they got to go on the bench. And my job is to empower you, to teach you to build that team.
And I think that's what makes this different. We're not handing families a report and sending them on their way. We're helping them build a roadmap. And I think at Amazing Kids, our main goal is to streamline the whole diagnostic process. We actually even try to make it happen within 72 hours if that is what the patient and family would like. When we talk about Amazing Kids Autism, we really started as a values conversation between the two of us. When families come to us, what do you hope they feel after that first interaction with Amazing Kids?
Yeah, so I want families to feel empowered, right? So with any medical diagnosis, the way our medical system works is you have to have a diagnosis to get intervention. And I think as healthcare providers, we'd probably prefer to not give anybody diagnosis because every diagnosis, nobody wants a diagnosis, right? And so, but that's just the way our system works. And so without a diagnosis, we can't get intervention. I want families to feel that, wow, my kid has autism. It's amazing. Like their brains are wired differently. And it's a beautiful difference. But guess what? At the end of the day, these kids can learn to be common. And that's what we need to teach them. We need to teach them to wave when they get when someone waves at them, smile when someone smiles at them, to understand when mom's having a bad day. I need to stop demanding that I want something and to stop there and go over and give mom a big hug. They have to pay attention to the world around them, and that's hard for somebody with autism. And so at the end of the day, I want families to feel trust, relief, and clarity. I want them to know that they're not alone and that we are here. At Amazing Kids Autism, we believe autism isn't a limitation. With the right support and the right team, children can build joyful, independent futures.